Hey people, I'm Mark Ryan, licensed acupuncturist and herbalist from Hashimoto'sHealing.com. And we are honored today to have as our guest Dr. Datis Karazian. Welcome, Dr. K. For most of our fans and followers, Dr. Karazian needs no introduction. Just in case you've been living under a rock and you don't know who he is, let me tell you a little bit about him. Dr. K is an associate clinical professor of preventative medicine at Loma Linda University of Medicine and an adjunct professor at both Bastyr University and National University of Health Sciences. He is a Harvard Medical School Global Clinical Research Scholar and a fellow of the American College of Nutrition. His first book, called Why Do I Still Have Symptoms When My Lab Tests Are Normal, literally changed the landscape of patient care for people with Hashimoto's and hypothyroidism. It's really mandatory reading for everyone with Hashimoto's, in my opinion. And he followed that book with a second groundbreaking tome called Why Isn't My Brain Working?, which has done something similar for our understanding of aging, neurodegeneration, and cognitive decline in people of all ages. And he has recently launched a new 6-week online course for the layperson that explores many of the themes in his book in more depth. Dr. K, we are so excited to be chatting with you today, my friend. Thanks for joining us.
Thank you, Mark. It's a pleasure to be here, as always.
So we've got a lot to cover, and basically my intention for today is to really give folks a sense of how Hashimoto's and hypothyroidism impacts the brain.
Okay.
Because I think most doctors and practitioners ignore this, and obviously it's way too important. Would you agree with that?
It's one of the main reasons why a lot of Hashimoto's patients still have persistent depression, persistent fatigue, and problems with focus, concentration, and mood.
Right. Okay. So one thing I've been investigating recently is how Hashimoto's is not the same with everyone. You know, many doctors and practitioners treat it the same way, but there's so much variation. You know, women who've been diagnosed can be at different stages of progression of the disease, at different phases in life, and the impact of all the other systems of the body, and the brain in particular, are often just simply ignored. So one thing I learned from you, Dr. K, was that autoimmune diseases like Hashimoto's go through progressive stages. Could you share with us a little bit briefly about what these stages are and why this matters?
Sure. So we know that most people that first develop an autoimmune disease first go into what's called the silent stage. In a silent stage, they don't really have any obvious symptoms, but their lab tests show high antibodies. So the labs show positive antibodies to a self-tissue. The tissue could be thyroid gland, or could be their adrenal glands, or could be their joints, it could be whatever tissue, right? But they have these antibodies with no symptoms whatsoever. So that's called silent autoimmunity. We tend to refer to that at stage 1. And then as the autoimmunity progresses, they get into something called autoimmune reactivity. And this is still not a disease yet. Autoimmune reactivity, the patient has symptoms of inflammation in the tissue that the autoantibody response is taking place in, but the tissue is still maintained and the labs still show positive antibodies. So you can have someone who has joint pain, for example, but they don't have deformity yet. And then stage 3, they actually develop classical autoimmune disease. So this is the stage where the current healthcare model diagnoses autoimmune disease, and that this stage 1 and 2, the silent to autoimmune reactivity, can take 10, 20 years to express into finally an autoimmune disease. By definition, in autoimmune disease, you actually have tissue destruction. The tissue is completely destroyed. It's very easy to make the diagnosis. So if you take those stages and apply it to, let's say, joint autoimmunity, stage 1, someone would have joint, like cartilage antibodies, something like that. And then as they progress to stage 2, they start to notice some joint swelling and inflammation. It may come on with certain foods, it may come on with stress, and then comes and goes. And then stage 3, those stage 2 symptoms happen for many, many years. And now they're starting to have nodules and joint deformity. And then they get an x-ray and it shows their hands are totally deformed. And that's the stage that's called autoimmune disease, where they actually get the diagnosis, but they may have suffered from all those symptoms all the way through. Yeah. And you could do the same thing with the thyroid gland, right? People have silent thyroid autoimmunity first, antibodies positive, and then they start to get thyroid hypo, but their thyroid TSH and T4, T3 levels are normal, because even though the thyroid is being attacked, they still have enough gland function to pass a normal thyroid test. And then eventually the thyroid gland gets destroyed, and their TSH goes up, they become hypothyroid, that's stage 3. So all the autoimmune diseases are going through these different stages to some degree. Some go very, very fast from 1 to 3, and some take decades to get there.
Yeah. And it's been my experience, I think, in treating people, that the further the disease progresses, the more cognitive impairment there is and the more impact on the brain. Would you say that that's accurate?
Yes, absolutely. So the brain is one of the most vulnerable and sensitive tissues to inflammation, and
Yeah.
all inflammation in the body has an impact on the brain. So you're right. As a person goes from silent to more progressed autoimmunity, the key factor is also that their autoimmune reaction or their inflammation, their immune response is getting more and more aggressive and more active. Those have significant effects on the brain.
And next, I'd like to look at the different times of a woman's life and how the brain may be impacted by Hashimoto's and hypothyroidism in those different periods. Now, I've been trying to identify what I'm calling Hashimoto's types based on the time of onset. And this isn't perfect, and some people inevitably fall outside of these types, but I think it's helpful because it helps us to look at how Hashimoto's can impact the body a little differently at these different time periods and different phases of life. So the first one is Hashimoto's kids. But Dr. K, one of the things we're seeing is it seems like more and more kids are getting diagnosed with Hashimoto's and autoimmunity. Do you find that to be true? Is it becoming more prevalent? And also, how does this impact the child's brain and brain development?
Autoimmune diseases are becoming prevalent, and this also applies to kids and kids that have Hashimoto's for the most part. Now, I think we're all seeing that as clinicians, that we're seeing more children suffering from autoimmune diseases in general. I know you've seen some.
Yeah, absolutely. I've seen it a lot more in my practice. Yeah.
And so have I, and so have other people I work with, and it's really quite disturbing to all of us. But for the basic concept is that when people have hypothyroid and Hashimoto's, if they don't have enough thyroid hormones, they're not going to have proper brain development. So with children, gray matter fully develops at age 8, white matter develops at age 18, meaning that your brain is still developing into your teenage years. Right. So if you're hypothyroid or have autoimmunity during that, you can absolutely impact your development and have developmental delays. You can not develop parts of your brain, and those things can have a long-lasting effect on your life.
Yeah. And any tips for parents who, kids have Hashimoto's and one of the things we were discussing this earlier is it's really important that if your child needs thyroid hormone and thyroid hormone medication, that you make sure they get it.
Yes, absolutely. That's one of the key things. Please don't be one of those parents that goes, I don't believe in medicating my children. Right. If your child is hypothyroid and they don't have the thyroid hormone replacement, they can have some serious developmental delays that have long-term effects. Right. But outside of that, they have an inflammatory autoimmune disease. I think as a parent, you need to start teaching them how to eat properly, right. And especially with things that are very inflammatory, like gluten and dairy-free. And I think you have to teach them to work with that in their life.
Right. I know I've done this with my daughter. I know you do this with your daughter. It's not as hard as it seems. A lot of parents get concerned, like, oh, geez, my kid's going to be deprived. They won't be able to go to parties. All the other kids are having gluten and dairy. But it's that important.
It is.
Yeah. All right, very cool. The second time period is adolescence. And these are what I'm calling Hashi-tweens. According to the research I've seen, mid-adolescence and puberty seem to be a common time period for onset of the disease. It's a time of major hormonal change, and that's bound to impact the immune system and other systems. Have you found that to be true? And how can Hashimoto's and hypothyroidism affect the adolescent brain and development during adolescence?
Well, I think it transcends through the entire developmental progression from birth all the way to adulthood. If you're hypothyroid in any part of that, you have developmental delays. If you have any inflammation, that promotes lack of proper plasticity or connectivity of the brain. So these things have an impact on your brain. Yeah. But as you get older, this is when you start to develop your sense of self and who you are, and you have to get ready for school and college, and you have to have a healthy brain to do that. So if you're an adolescent or a teenager and you're suffering with Hashimoto's, you definitely have a huge burden and challenge in front of you, in addition to being a teenager and growing up. So
it's hard enough being a teenager. I'm just kidding with that.
But this is why it's so critical for them to really get a handle of it really quickly.
Right.
I recently had a really phenomenal experience. I had a patient I've seen years ago. Her parents were both medical physicians, and she came into my office as a teenager with Hashimoto's, just devastated because she was having problems at school and problems with her weight and her metabolism and all these things. And she learned to incorporate all those things into her. She just graduated from college, and now she's going into naturopathic school to
help. That's awesome.
other people with Hashimoto's. So it's amazing to see someone
Right.
that was suffering as a teenager learn how to help herself, and now she's committed to sharing that with other people in her life. So that's
Right.
fantastic.
That's a great story. Yeah, and that shows there is hope. It's not, it's not something that's a death sentence or uh, you know, is going to take your life away. But it's a very important time to make changes
Yeah.
for later on in life. How about things like ADD and ADHD? That often this is another thing that seems to be more prevalent. Students of this age are often diagnosed with this. How is this impacted? And how does
I think
how
the
does it-
autoimmunity itself is going to perpetuate many of the mechanisms that promote ADD, ADHD, because the brain is not going to necessarily develop as well. So ADD, ADHD are actually lack of development of the frontal cortex. The frontal cortex is involved with focus, concentration, attention, and when this area of the brain doesn't have the ability to develop and connect, many people have issues with attention and focus and concentration. Now, the mechanisms that cause that is inflammatory, and then you have a whole spectrum of research where things like when ADD kids go off food coloring, they have dramatic improvements. When they go on a diet, they have dramatic improvements. When they support themselves with anti-inflammatory compounds or things like fish oils, they have some great changes. So many of the things that cause ADD overlap with the mechanism of Hashimoto's primarily being inflammatory.
Yeah.
So once they can modulate their inflammation and their autoimmunity and support their brain health, I mean, it's really the way to go. The fact that they have Hashimoto's means they have risk for any kind of developmental delay, including ADD or ADHD. And this transcends into adulthood. If you don't take care of it as a child, you become an ADD, ADHD adult, which means you'll have difficulty your whole life with jobs, work, business, life, relationships.
Yeah, hugely important. And again, this phase of life also important. The diet is the foundation, right? Gluten and dairy and these other inflammatory foods.
If you have
So important if
Hashimoto's, yeah, and specifically for people that have Hashimoto's, those are key factors.
Yeah. The next is the postpartum period. These are Hashi moms. Another really common time for onset. Right? Big fluctuations in the immune system happen, and big changes with hormones in pregnancy. Could you talk a little bit about that? What happens postpartum, and particularly how the brain is impacted?
Right. So I think what a lot of women will notice that they've never been the same metabolically after they have their first child, or they just feel like their metabolism never clicked in after they gave birth. And many times they actually had their autoimmune Hashimoto's turn out. Sometimes they know it, sometimes they don't know it. Right. For those who know it, they usually get diagnosed with postpartum thyroiditis, which means the pregnancy hormone surges promoted an inflammatory condition for the thyroid, which is very common. Now, those inflammatory reactions have a significant impact on the brain. Now, the ones who know they have the diagnosis of thyroiditis after pregnancy can at least get some focus and maybe get some direction where they need to go. But the ones that just have their autoimmune turn on and they're autoimmune reactive, where they have some inflammation, they may not understand why they can't get out of bed and they don't have any motivation. And now they have theoretically the point of their life which should be the most joyous. They have their child, they gave birth, but their brain can be so inflamed that they have no motivation, complete depression, and they may doubt themselves as parents. It can be a really tricky situation.
So the autoimmunity certainly has a role in postpartum depression then.
Oh, absolutely. So the autoimmunity itself, again, triggers an inflammatory response, and the inflammatory response impacts the brain. When the brain gets inflamed, it's very common to have depression and lack of motivation and drive, focus, concentration. And then you add that on top of not getting enough sleep, because as new moms, you have to take care of your child. Right. You have this combination where your brain function dramatically goes down, but you also significantly accelerated a neurodegenerative process if you're not sleeping and your brain's inflamed and you have this ongoing autoimmunity.
Yeah. Oh, very interesting. The next is sort of related to pregnancy is infertility, right? This is the Hashi heartbreak. It's really emotionally devastating for many people. What is the link to Hashimoto's and hypothyroidism with infertility? And again, how is the brain impacted? And how is the developing fetus's brain impacted in this situation?
So, first of all, I mean, if you're hypothyroid, you're going to have a very hard time having fertility. And this is one of the reasons why when people go into a fertility clinic, they always rule out hypothyroidism. So thyroid hormones have an impact on proper ovarian function, proper hormone releases, and so forth. Right. So you got to make sure you don't have high TSH and hypothyroidism if you're having fertility issues. Now, the autoimmunity itself creates inflammatory cascades. Those inflammatory cascades have mechanisms that also disrupt healthy fertility. But the key thing also is many people that have autoimmunity have other autoimmune reactions that can impact their fertility. So people that have antibodies to phospholipids sometimes have an autoimmune response against their reproductive tissue or ovarian antibodies that tend to create inflammatory reactions, or they have more vascular insults from phospholipid reactions.
Right.
But the point is this.
For people who don't know, that phospholipids are the bilayers that surround cells and create cell walls. Yeah.
Right. So thank you for sharing that. But so the point is that there's this inflammatory cascade. So yes, if you're hypothyroid, you have a risk. If your Hashimoto's and your inflammation isn't controlled, you have more potential for infertility. Right. But the other key thing is now what happens to the child. So exactly. So the inflammatory reaction to the fetus is very interesting, and there's some research showing that children that have autism have fetal brain antibodies very early on. So there's theories of potential autoimmunity developing in many of the children that have autism. In the immunology literature, immunology research, are really considered brain autoimmune patients. So does that happen or not? It's hard to say, but we do know this. We know that the research clearly shows if you have an infection or immune activation during your pregnancy, you do have a higher risk for having a child that has autistic patterns. Okay, so it doesn't mean if you have Hashimoto's that you will directly get a child. You will end up having a child that suffers with autism. It just means you have an increased risk. Higher risk. So the more inflamed a person is, the more immune challenges they have, the higher the risk is for having a child that has autistic patterns.
Right. So, I think tips in general, you want to make sure your thyroid healthy prior to conceiving. Any basic recommendations during pregnancy of things to do?
I think you should probably work with your practitioner more often and listen to your symptoms very cautiously, and just make sure nothing's being missed.
Yeah. The next period is perimenopause, or what we call the Hashi hormone hurricane. Now, obviously, another time of major hormonal upheaval. The adrenals step in as the ovaries decline. So can we talk a little bit about that? How is adrenal fatigue or exhaustion impacted in this? And again, how is the brain impacted during the period of perimenopause?
So just like we have hormone surges in a postpartum state that promote autoimmunity, there's also a hormone inflammatory cascade that takes place in perimenopause. So many women will also complain that their metabolism, their mood, and their energy was never the same after they went through their hot flashes and through their perimenopause pattern, right? Mm-hmm. So one of the things that we know is that when a person in perimenopause, what's basically happening is the ovaries are losing their communication ability with their pituitary feedback loop, right? So there's a hormone in the pituitary called FSH. Right. It releases hormones for the ovaries. There's a reaction. That feedback loop gets compromised and less efficient. What the research shows is that turns on this inflammatory cascade. And these inflammatory cascades feed a pre-existing autoimmune susceptibility. So for a lot of patients that have some subtle autoimmunities, or maybe they're in stage 2 or stage 1, they can really turn on the disease process when they lose that pituitary ovarian feedback loop. And you'll see that all the time clinically. So they'll have hot flashes, and they'll start having night sweats, and their cycles start to change. And then all of a sudden they have new thyroid symptoms, or the thyroid symptoms get worse. So you have to actually try to get them through that. And like you said, supporting their adrenal gland function is one key way to do it, and all the other things that are specific to their autoimmunity.
Right, and I think it's critical too. Like this, really, it's not just a hormonal or adrenal issue. It really is the brain is intimately involved in that inflammatory cascade, that period.
Yeah.
And finally, we looked at women who are 60s and over. We call the Hashi sage. And I think what's interesting in this period is for many of these women, they've had Hashimoto's and hypothyroidism for many years. For some, it's been properly managed. For others, unfortunately, it really hasn't. And I think we see the development of dementia and Alzheimer's and Parkinson's, these other degenerative brain diseases, and sometimes people don't realize that also can be linked to this process. Could you talk on that?
Sure. So let's just say we're talking about a hypothyroid patient who is controlled with replacement. So TSH and hormone replacement is not a factor. So we know that all these autoimmune diseases, whether it's Parkinson's or different forms of dementia or just overall brain degenerative changes that take place, are due to inflammation. So the inflammatory cascade feeds all of them. And basically, without getting too technical, inflammation disrupts cells that are called energy-producing parts of cells called mitochondria. As they're lost, people lose the ability to clear proteins out of their brains that they normally should. So these proteins are called tau proteins and alpha-synuclein. They get in the way of normal transmission, and then the brain starts to atrophy away. When you're hypothyroid, when you're autoimmune, when your brain's inflamed, that process happens much, much faster. So if you have someone who has Hashimoto's in their 60s, I mean, once you turn into the later part of your life, your biggest battle is to maintain your brain, because that's what's going to basically destroy your life at that point. So you have to get the inflammatory mechanism under control.
Fantastic. And you know, how do we distinguish between normal aging and neurodegeneration? You know, like oftentimes when people say, well, I'm just getting old, so I'm having this symptom, I'm forgetful, or forgetting my keys, or you know, I'm getting tired easily, but it's not aging. I mean, people who are in their 80s and 90s are very lucid and don't have those problems, but a lot of times it's blamed on aging when it really isn't.
Yeah, so any loss of brain function is brain degeneration. Yeah. So if you lose your ability to recall things, and it's permanent, it's long term, you probably have degeneration in your memory centers of your brain. If you can't focus like you used to, you've degenerated areas of your brain that are supposed to be focused, like your frontal cortex. Yeah. So we tend to just kind of name these things as aging, but it's not. It's a neurodegenerative change. So what's normal is different than what's common. What's common is most people have multiple factors that cause their brain to degenerate. So as they get older, they lose their function. Now, what's abnormal, but a sign of not abnormal, but less common, I should say, not abnormal, but less common, is that you have the 80-year-old who's still running a business, who's still going skiing, he's still doing things. And the difference between that person and the 50-year-old who can't do anything anymore and doesn't want to do anything, and they're grumpy, and they can't focus, they can't concentrate, and they have no motivation in life, is quite simply the health of their brain.
The brain, right.
That's it.
Yeah, what it comes down to, exactly. All right, awesome. I mean, that was a wonderful overview of all these different phases of life and how the brain is impacted. Now, you've created this program for people, and obviously, I think it can benefit anyone in any stage of life, correct?
Yes.
Could you just talk a little bit about the program and just tell us why you created it and what some of the goals are that people go through it?
So the program, the idea for developing this Brain Fog 6-week program was really because we have a lot of people that have read my brain book, Why Isn't My Brain Working? And it's a bit of a detailed, thick book.
It's a tome.
And we had some people say, I really need to figure out what to do with my brain, but I don't have enough focus and concentration to get through the book.
Get through the book, right.
Other people said the book was great, it made a lot of sense, it was easy to understand everything, but I don't know where to start.
Right.
So we started with this 6-week program where we hold someone's hand and we give them video clips, and we have goals that week with a workbook, and as they watch the video and go through the workbook, they can kind of go through the key fundamental steps we think are critical in the importance they need to do it. So like the first week, we teach people how to identify which parts of their brain may not be working, what exercises they can do to activate those areas, how to do their own neurological exam. And as we go through each of the weeks, they learn more. Now, it's a 6-week program, but people have access to the course material after the 6 weeks. So if they want to go at their own pace, they can do it. And some people that have compromised brain function can do that. But I think for even people that don't have a lot of neurological symptoms, it's just good to have an understanding of how to identify early brain degeneration symptoms, because we all are going to be faced with them. Exactly. And then what kind of things make the biggest impact.
Yeah. And I mean, there's really nothing more important than protecting your brain and doing everything you can to preserve it.
Right. I mean, absolutely.
I mean,
that's it.
What's a better investment than that, really? All right, awesome. Well, I'm super excited about the course. I've been sharing it. A lot of my fans and followers, and a number of people have signed up. I'm super excited about that. I'm also going to be going through the course with them and offering some additional commentary and stuff. So I'm really excited for it. Thank you so much for doing it. Awesome. Great stuff. Wow. Lots to think about and process there. Now we're going to go to the Q&A. I got a ton of questions. We have about 30 minutes to answer them. We're going to answer as many as we can in that time period. And the questions we don't get to, I will address on my own. And we're also going to have, we're going to open this up to Q&A. So those of you that are here and would like to ask questions of me, I'm happy to answer them as well. So we'll see you after the Q&A. All right, we're back with Dr. Tis Karazian answering questions that were submitted on Facebook and via email. I got a ton of questions. Dr. K, everybody always wants to pick your brain, of course. No pun intended. Okay. If fasting is good for people, please explain why it is best for people to eat within an hour of rising.
If fasting is good for
So I guess the first question is fasting good for people? Yeah.
Well, fasting can be good for some people, but it can't be generalized for everybody. So there's some people that have significantly compromised adrenal function, blood sugar issues, that fasting will totally destroy their health, their function. So,
Right.
but fasting is good for example, neurodegenerative changes. When people go into low caloric intake or go into fasting periods, that has an impact. Now, when you're asleep, your physiology changes. So when you're asleep, your metabolic rate, your circadian rhythms, everything is functioning differently than when you're awake. So for some people, when they have, especially for they have low blood sugar issues, when they arise, if they eat within that first hour, they tend to have an easier time stabilizing their blood sugar issues. But it's not to say that that generalization applies to everyone, so.
I mean, that's the bottom line. There's so much variability, and so many people are different. And right,
Yeah.
if you have reactive hypoglycemia, you got to be really careful about fasting.
Yeah.
Okay. Next question. What are some of the things that can be done to prevent further brain deterioration? Well, taking the course is one thing to be done.
Well, simply put, whatever is inflammatory is bad for your brain.
Yeah.
Whatever you notice makes you immediately lose your brain function. Whether you eat a certain food, you don't get enough sleep. I mean, it's pretty obvious what some of those things are.
Right.
But
common sense, often.
It's common sense. But sometimes you just really need to see it laid out for you and then have steps to actually implement them. And
right.
That's what we try to teach people.
Exactly. Okay. Next question. How can you get rid of anxiety and OCD from Hashimoto's? Yeah. Anxiety is a pretty common symptom, I find, with Hashimoto's.
So, I mean, to get technical, when you look at mechanisms like OCD and anxiety, you're looking at increased activation of the limbic regions of the brain. Those regions of the brain are either overactivated or those regions are not being inhibited. They're there. The brain that inhibits them is the basic ganglia indirect pathway. So without getting too technical, it depends on what the mechanisms are. For some people, you have to do a neurological approach to trying to increase activity in the areas that inhibit the brain. For the other people, you try to look at metabolic things. There's a large group of people that have Hashimoto's that have GAD antibodies. GAD is the enzyme that makes GABA. And GABA is the main neurochemical pathway to dampen anxiety and to dampen these regions of the brain that cause OCD.
Right, it's a calming neurotransmitter.
Right. Yeah. So if you have antibodies to the neurotransmitter enzyme that makes your neurotransmitter to calm things down, then you have to control it from an autoimmune perspective. But again, there's no general treatment just to say if you have Hashimoto's and OCD, this is what you do, because it's unique for different people, right?
Right, that's always the key. You have to find the mechanism, you have to find the root cause and the reason for that manifestation. Next question, how do you get rid of fatigue? I mean, often fatigue is brain-based with autoimmunity and Hashimoto's.
Right. So for me, when I am trying to look at what's happening with patients or teach practitioners how we think through a case, we ask the question, if they have fatigue as a complaint, the question we ask is their fatigue brain-based? Right. And fatigue that's brain-based means they get tired when they use their brain. So fatigue that's brain-based is, for example, when they read, they get tired. When they drive, they get tired. When they're on the computer, they get tired. That's different than, let's say, metabolic fatigue that just hits you all the time. Right. So a lot of times patients will say hey, they have chronic fatigue, they've supported their adrenal glands, they've taken all these nutrients to improve their energy, they've tried supporting their thyroid, they've checked all these things, but their energy doesn't change. And you actually ask them questions and you find out that their history is brain-based, that only happens when they use their brain. And the days where they don't have to use their brain, like the weekend where they can sleep in and get plenty of sleep and don't have to be on a computer or working, those are great days for them. And they're trying to look at their diet to see what's making the difference, but it's just sometimes it's the endurance of the brain. So as the brain starts to degenerate, the first thing you actually lose is your endurance. And when you lose your brain endurance, you think you have chronic fatigue, but the fatigue is very clear to understand what's coming from because it's dependent upon you exceeding your brain's endurance.
Right. Yeah, interesting. Sort of related question, can antibodies by themselves cause fatigue?
Well, antibodies by themselves, not typically don't cause fatigue, but it's very interesting when you talk about antibodies to the brain, because antibodies in general don't really destroy tissue, but antibodies for the brain are uniquely different. So antibodies for the brain and the immune system in the brain are a little bit different. So if you have antibody elevations to neurological tissue, they can cause brain inflammation, which can fatigue you. But antibodies themselves don't necessarily have a direct cause. Right?
Attack directly. Yeah.
Yeah.
They signal the attack more often. All right, next question. How important is knowing if you are Th1 or Th2 dominant in Hashimoto's?
It's really important to find out what things could be triggers for you. Not as important to know how to necessarily treat yourself, because that's one part of the big picture of treatment. So you have to look for potential plant compounds or nutrients or herbs that can flare up your condition. So for a lot of times, for a lot of people, once they find out that, hey, they could actually have an adverse reaction to grapeseed extract, or they can have this reaction to green tea, or they can have this reaction to echinacea, and they start to look for that and they see that pattern, we are able to help them remove a trigger that they may not know about. So this Th1, Th2 list is something we really want autoimmune people to look at least have that consciousness of looking for those things potentially inflaming them or triggering them, because the potential is there.
Right. And as you stated before, the inflammation is at the root of much of the problems with the brain and other aspects of autoimmunity.
Yeah.
Okay. Next question. I know you feel that patients with Hashimoto's should be very wary of iodine.
Yes.
Yes, we've been through this. L.C. Labs makes a supplement because they feel it is important. I've heard you say that iodine testing is not reliable. How do we know if we should supplement naturally with kelp or not at all? I'd be curious to hear if there are differences between men and women, I guess, regarding iodine. So, I mean, I know how you feel about iodine, but do you want to talk briefly about that?
Well, let's just go over a couple things. Iodine deficiency. Yeah. Iodine is really critical for many metabolic steps. It's an essential nutrient.
Especially for the thyroid.
Yeah. And many people are iodine deficient, just like many people are magnesium deficient and manganese deficient and molybdenum deficient, Right. But just because we have a group of population of people that are deficient doesn't mean it's appropriate for people that have specific disease, right? So iodine triggers the production of TPO. That's the target protein for autoimmunity. There's lots of research that shows iodine flares it up. And all this talk about selenium counteracting this and to counteract this from a different nutrient is made up. It literally is made up. It's not based on research. It's someone's theory. It's on the internet. People are referencing it. Right. And people are using research. Well, they found a study in China but China is selenium deficient. Well, guess what? Everywhere is selenium deficient. So that doesn't. So anyways, so these poorly correlated things that are happening. At the end of the day, iodine can be very inflammatory for some autoimmune people. But this is what I think people don't understand. What's realistic in a clinical setting is that there's some people who take iodine and they actually do feel better. Right. But is that the right thing to do? So there's some variables we don't know, but we also do know of one common variable that we see. When a person has Hashimoto's takes iodine, they can actually promote their destruction of their tissue. And when they destroy their tissues break down that have thyroid hormones in them. So now they have a surge of thyroid hormones in their bloodstream.
Which could be why they feel better.
Which is why they feel better. And this is why, and we see on labs the antibody count that goes up. So here's my proposal. And I've said this now every chance people have asked the iodine question. Let's do a debate. Let's get the pro-iodine, anti-iodine. Let's all pull our papers. Yeah. Let's exchange them, and then let's have a debate. Yeah.
And let's come up with a way of doing it so that we can evaluate what's happening while we're doing it. Yeah, that's the other thing. People take it and they don't pay attention to how it's impacting them.
So here's the problem we have. We have all these people with opinions, but we have one side not willing to talk together and end the confusion. Yeah. So we're ready to talk. Just let's do it.
Let's do it. I like that idea. Okay. Great comment. Next question is actually about SIBO. This person says, I think the SIBO test the breath test is not reliable. How do you know if someone has SIBO or some other similar problem with similar symptoms? I mean, I think it sort of brings up an interesting connection, too, with the brain, because the brain and the gut are intimately involved.
Right. So as the brain degenerates and you have in the degenerative process, what people may not understand is that the brain has most of its output to the brainstem. And the brainstem has your autonomic functions like your heart rate working on its own and digesting food and making enzymes and motility. So when the brain starts to degenerate, there's lack of activity to the vagus. And then the vagus also controls your valve control. So there's some people that have brain-based SIBO or small intestinal bacterial overgrowth. So as their brain degenerates, they can't fire it and have healthy integration of their vagus, so they can't control their valve between their small and large intestine. And then bacteria that should only be found in the large intestine moves into the small intestine, which is the small intestinal bacterial overgrowth. It's not that they have a bacterial infection, it's that the bacteria that's in the large intestine has the ability to go into the small intestine because neurological valve control is impaired. So lots of progressed neurodegenerative individuals, people that have impacts of the brain for metabolic reasons over time, start to have accelerated neurodegeneration, they lose their valve control in their gut, and they get small intestinal bacterial overgrowth. Now, the testing for it is you do a breath test to test for hydrogen and methane, which check for most of the species, most of the common species for SIBO, but it doesn't always check for all of them. So if you have adverse reactions to carbs and starches and sugars, that's one way to see if you have it. Or you can just do a trial of the FODMAP diet. The FODMAP diet gets rid of your bloating. It's pretty good clue that you have small intestinal bacterial overgrowth.
Yeah, I think it's really interesting. A lot of people don't realize that the digestive tract also is another nervous system. You can have neurodegeneration of the enteric nervous system as well.
Yeah, exactly, and that's another thing too. Is chronic inflammation in the gut, whatever the cause is, chronic celiac, chronic inflammatory bowel disease, degenerates the gut it's as well as it degenerates the brain. And now they're showing research that the inflammatory reactions that build up in the gut and these things called Lewy bodies that promote Parkinson's start in the gut, and they actually move up the vagus nerve into the brainstem and into the brain.
Wow.
And that some of these things may originally originate from intestinal inflammation as the working theory of research. Yeah, it's very exciting. Yeah,
that's very interesting. Huh. So sort of related to the iodine question, is there a multi-mineral or multi-trace mineral without iodine that you would recommend?
I tend to not want to recommend any brand name supplements, but they're definitely out there.
Yeah. Could not having a gallbladder be at the root of insomnia, pain, anxiety? That's kind of a shit question.
Well, when you have your gallbladder removed, the cystic duct, which is the duct that is the place from your gallbladder going to your small intestine, starts to balloon out and becomes its own gallbladder. It's not as efficient. So I don't know of the direct cause between them. Certainly, there could be a timeline where a patient notices that, but I don't know what the direct cause could be.
Okay. Here's my question for Dr. K is to ask him the relationship of Hashis to celiac, gluten, and gluten intolerance. Also, what can you do if you have Hashis and some of the celiac, but not all of the celiac markers? You cannot eat gluten. That's what you could do.
If you have Hashimoto's, you just simply put, it's pretty overwhelming evidence you shouldn't be eating gluten, whether it's celiac or not.
Right, and that's what I say. It's like, whether I see it, it's like, what is the destructive potential of gluten? That's what you always have to think. Like, when you make a decision, that's what you have to weigh, risk versus benefit. And the destructive potential is just too great. And
it's at the point now where there's just research where they just remove Hashimoto's patients off gluten unrelated to celiac disease, and they see improvements in their function and symptoms.
Right.
You don't have to have celiac disease to be the person who has to go off gluten if you have Hashimoto's. If you have Hashimoto's, there's enough evidence to just be gluten-free.
Right. I think often, too, we also see how getting off of gluten really improves thyroid hormone function, even with replacement hormone. It starts to work a lot better.
And there's a few papers that have specifically published on that mechanism.
Yeah. Is it possible to lose weight with Hashimoto's, and how? That's a loaded question.
Well, I think it's a common frustration for a lot of people.
Yeah,
and I think what's interesting now is there's the field of immunometabolism, where immunologists are coming to the table and trying to explain slow metabolism and weight loss, right? Because up to this point, it's always been about hormones. The reason you can't lose weight is because you have too much cortisol or too much insulin, or you don't have enough thyroid hormones. But what the trend is going into obesity research and metabolic research is that inflammation itself completely disrupts the ability to lose weight. Gut microbiome diversity completely disrupts your ability to lose weight. Things like intestinal permeability can promote mechanisms where you can't lose weight. So all these things are now coming into literature, and I think as time goes on, you're going to see all these new breakthroughs in weight loss, and it's all about inflammation, which is already happening, and less about hormones, right? So Hashi's, it's all an inflammatory autoimmune game. That's the hardest part about it, and that's why it's so difficult for so many Hashimoto's patients to control their metabolism. They're playing this very uphill battle with their disease process.
Right, and there's so many potential causes of inflammation too. They're not always obvious.
Right.
Like stress, other
Environmental triggers they may not even know
environmental triggers.
about. Yeah.
Right. Interesting question. Is the MTHFR and MTHFR mutations that are often found in Hashimoto's population, are those a factor in brain fog and brain degeneration?
Sure. So we know that people that MTHFR are people that have a gene uniqueness where they can't process methyl groups, which are typically found in things like B12, right? Folic acid.
Right.
Methyl is a one carbon transfer group. So people that have deficits in methylation transfer of one carbon groups tend to have more depression and neurodegeneration, all these symptoms. So it's like anything else. It's like you have layer over layer over layer. So if you have Hashimoto's and brain inflammation and maybe even brain autoimmunity as your second target site for Hashimoto's, and then you have a methylation impairment on top of that,
right,
and then you're not eating foods that support methylation, you add to the potential cascade of brain degeneration.
Right. That's a very interesting question. Let's see. So this question I get relatively frequently. What if you've tried almost everything and it hasn't worked?
Welcome to the autoimmune disease world.
Exactly. Go back to the drawing board. It's always, you got to keep trying. You got to keep trying.
You got to keep trying. But this is actually how I used to teach practitioners. Like when someone comes in and they've done everything and nothing's helped, you can pretty much bet they have autoimmunity, and that's when you start digging for that. So autoimmunity is no joke. But here's the thing. Sometimes the perception is where the problem is. So when a person has autoimmunity, sometimes they're just thinking that I'm either healthy, I'm either cured or not cured. And when you develop an autoimmune disease, that doesn't work because you have an uncurable condition. So the question really has to change to, am I in remission or am I in relapse? And how do I better go into remission? Exactly. So once some people have that understanding with an autoimmune response, then they don't feel so defeated and beat, and they kind of understand how these things are. Right. So my experience has been when people say nothing has helped, that's really not the key thing. Is nothing has cured it, because they're unfortunately suffering from an uncurable condition, which does exist in the world, and unfortunately autoimmunity is one of them. So they have to learn how to change their lifestyle and their mindset, and if they do that, they maybe have much more good days and bad days, right?
Exactly, and I think that's critical too. It's really about first, right? Are you moving in the direction of remission? Have you achieved remission? And then, do you maintain that remission? Like it's not. There's no destination here. It's an ongoing journey that constantly has to be recalibrated and reevaluated and reworked.
Absolutely. And even the people that do everything right and get into remission, they will still have flare-ups. Sometimes they have no idea why, because there's factors that they haven't identified, and that happens. Right. But the more people look into the causes of their flare-ups and understand them, and then that helps them keep into a state of remission longer. That's the key model.
Yeah. Okay, we're almost out of time. Let's take one more question, and then we'll wrap it up. What do you think of the EB, the Epstein-Barr connection to autoimmune? And if you agree that it is virus-related initiated, then what are the recommended solutions? A lot of people have this. I mean, in my patient population, Epstein-Barr is hugely, hugely common. I mean, in the general population it is too. What are your thoughts on that?
So there's definitely viral models of autoimmunity. When people get a viral infection, they have an autoimmunity. And those viruses like Epstein-Barr, they outsmart the immune system. So we always have, once we get the infection with the virus, we have in our body, and then they're just waiting for opportunities to express themselves. So if you don't have sleep and you have stress and those things add up, then you can have the Epstein-Barr flare-up. So people that have viral-based Hashimoto's, they'll have Epstein-Barr flare-ups, and they'll get their Hashimoto's symptoms flared up as well. But the problem with Epstein-Barr is that everyone tends to blame something for it, and I don't think people understand that. From a laboratory perspective, if you check antibodies, 90% of the population is going to have positive Epstein-Barr antibodies, which just means they've been exposed. So you really need to do an Epstein-Barr viral panel where they look at viral capsid, viral antigen load, and then you can see if it's actually flared up or if it's just past exposure. Right. But it's not uncommon to see people go to practitioners and they check for Epstein-Barr and it shows positive antibody. Now they think that's the cause, and it's really not, right?
Right. Yeah, I mean, I think it's the other thing. Ultimately, there's often multiple causes. Yeah. It goes back to, again, lifestyle and management and balance and creating supportive life for this condition.
Yeah. But for those that do have virus-induced antibodies, we actually find those are the ones when we really support their immune system, both the Th1 and Th2 sides, they actually tend to do better. But again, there's uniqueness for each individual, but that's just a common thing we see.
Right. Which is helping to fight the virus when it's activated.
Yeah.
Right.
Yeah.
Right. All right, awesome. Well, I think it's about all the time we have today. This has been fantastic. As always, Dr. K, it's always a pleasure to talk to you. I learned so much every single time. I'm really, really appreciative you've taken the time to do this for us.
Thank you, Mark. Great job with all the stuff you're doing and reaching out to the community. I know a lot of people are really grateful for all the stuff you put out.
Yeah. Thank you, my friend. Look forward to speaking to you again in the near future. And your course starts when? What's the date?
So our brain fog course starts April 11th, and you can register, but after registration closes, we won't teach it till who knows when, but you can still have access to the course. If you can't start right at April 11th, you can always log in and get the information.
Right. It's going to be a fantastic course, not something that you want to miss. So thanks again, my friend. We will talk to you soon. Have a great rest of your day.
Okay, thanks, Mark. Appreciate it.
Wow. Awesome stuff. So we actually had so many questions that we couldn't get to probably 2/3 of them. So what I did was record an additional Q&A video that answers every last one. So be on the lookout for that. I'll be sharing that a little later this week as a special bonus for people who attended the webinar. Okay. Now we're going to go to your whatever questions you have now. And before we do, I just want to let you know it is still possible to register for Dr. K's program if you're thinking about it. And as I mentioned, if you go through us, there's a couple of additional bonuses you'll get. Firstly, I've recently upgraded my Save Your Brain program. And we have new videos and content in there. And we'll walk you through step-by-step evaluating your brain health and look specifically at how Hashimoto's is affecting it. There'll also be some additional commentary on Dr. K's course. And essentially, what we'll be doing is a study group with me. And we'll be looking at what we need to do to fix these things. So if you want to take advantage of that, it's free. Just click on the link below. The newly upgraded version of Save Your Brain, which normally costs $147, is free of charge. Also, for the first 10 people who take advantage of this, you'll get a 30-minute session with me, and I'll send you instructions on what paperwork to fill out. I'll review it and then give you some specific recommendations on what to do. That 30-minute consultation also usually costs $150. So you get both things included as bonuses. That's $297 worth of bonuses. Again, it's for the first 10 people. I only have a limited number that I can accommodate because I have so many other things going on. All right, cool. So let's go live now, and we'll open up to whatever questions you have. I'm Mark Ryan, licensed acupuncturist and herbalist from Hashimoto'sHealing.com. Be good, be kind, and remember to have compassion for everyone, including yourself and your brain.